Yes, did you page pharmacy?
Oh, hey, great. I'm glad you're here. Hey, I'm George.
Hey George, I'm
Alright.
Lori. I'm the pharmacist.
Great.
I'm on the floor today and be glad to help you with anything.
Okay, cool. I'm glad you're here. It's great to meet you. I'm glad we have pharmacy here. So I'm a new nurse here,
Okay.
and I'm starting a heparin protocol on Mr. Mongoose. Dr. Whitehead ordered it, and this is my first time doing it. I know that we talked about it in orientation. We had a pharmacist come and talk about heparin protocols, but I just wanted to run everything by you and make sure that you could double check my work so that we can make sure that everything was right before I actually started.
Absolutely, absolutely. Yeah, I remember I verified Mr. Mongoose's heparin protocol a couple of minutes ago. So first, have you pulled the drugs yet?
Yes, ma'am. So I have the injection, and then I
Okay.
also have the drip ready.
Oh, great. Okay, well, let's pull up his MAR here on Epic, and that way we can kind of navigate and I can show you a couple of things about how the protocol looks and how to follow that.
Okay.
I think first with the heparin protocol, the most important part is to verify the weight. So we look up here in the header and there it states that Mr. Mongoose is indeed 95 kilograms. Does that seem accurate to you?
Yeah, that seems appropriate. But my question now, so I have a weight here of 95 kilograms, but then I also see over here there's an ideal body weight, and how do I know which one I'm supposed to use for the heparin protocol?
Right. Well, for this particular protocol at our institution, we do use actual body weight.
Okay.
And I would say most protocols do use actual body weight. So that's something you'll see automatically when the protocol is entered by the physician will choose the actual body weight.
Okay. Very
Now, just an aside, because you might get a patient that is a little overweight, if they're over 125 kilos, the protocol will calculate an adjusted body weight for those patients. But that's specific to this institution, and that can really vary. But if we're thinking about Mr. Mongoose, who we're talking about now, we will use his actual body weight of 95 kilograms for this heparin protocol.
Okay, so I've got the actual weight and then the ideal we're never going to use, and then just only in the case of a patient who is heavier over 125 kilos, you said.
That's right.
Then it would automatically calculate an adjusted for me.
Right.
Okay, very good.
That is right. So I think the other important part is after the weight, you want to look and make sure Mr. Mongoose has had his baseline labs drawn. And that is the CBC, the PT, as well as the PTT.
Okay.
And again, with the PT, they'll also report the INR. So we need to make sure those have been completed for Mr. Mongoose and make sure they're normal before starting the drip. Now, in a situation, if those haven't been drawn, we do need to make sure, if you don't mind, as the nurse, making sure, since this is a nurse-driven protocol, making sure those are drawn. So if we look in his Epic profile, we click on our results review here, you can see under hematology, we see his CBC, which looks great. And then under his coagulation, we'll see his baseline PTT, which is normal, as well as his PT-INR. So all of that's normal, and it looks like we're ready to start the protocol on him.
Okay, so yeah, we pulled the labs earlier this morning, they've resulted as normal, so now we're ready to go ahead and start. So my next question is, I see that on the MAR, I have 3 different injections, right? So I know that I have this bolus injection that I'm going to start him on. What are these other 2 doses for?
Okay, great question. So the bolus injection that you have pulled here is the one-time initial bolus injection.
Okay.
And you'll see on the MAR it says once.
Right.
So this is a one-time initial bolus before you start the heparin drip.
Okay.
I also want to point out that you never want to bolus the patient from the infusion bag right here. So one of the things, when you do pull out your infusion bag, you should always pull out a separate injection to administer the bolus out of.
Both.
So that takes care of the one-time bolus before you start the heparin drip.
Okay.
Now, you also mentioned the 2 other boluses.
Yes.
And those are on his profile as PRN, or as needed.
Right.
And you'll see those notated as the high-dose bolus as well as the low-dose bolus.
Okay.
The situations where you will use those 2 boluses would be if his PTT is too low. And that really directs you back to the protocol, which if you look under the administration instructions here under the heparin infusion. You'll see the protocol laid out very nicely here. So our goal is 61 to 90. That's a PTT of 61 to 90. So anything below 60 or below is too low, of course. That's when you might use your bolus, and you're probably going to increase your rate. And then anything above 90 is going to be too high. And you'll see, according to the protocol, at that point you may just decrease the rate, or you may have to hold the drip for a specific amount of time, as well as increase the rate.
Okay, so that makes sense.
You know, again, everything is right there in the protocol. You'll see it on the MAR. But I think the questions that you have about the boluses are good because it can be confusing. So, you know, when you document, especially with your PRN boluses, you want to make sure you document appropriately under either the low dose or the high dose bolus.
Most definitely. Yeah, so I see the ranges here, so I guess if it was in this range, then I would be using the low dose, and then this range I was using the high dose.
That's correct.
That makes sense.
That is correct.
Okay, great. I think I have a pretty good handle on it. Let me just, could you double check with me the dose? So I'm ready to pull up the bolus injection. Could you just tell me how many mLs I'm going to draw up?
Okay, so you're right. You've got the injection that you're using for your bolus, and that is your 5,000 unit vial. So let me double check my calculations, and I'll let you know how many cc's to draw up from the vial, and we can kind of compare notes.
Okay, perfect.
Okay?
Thanks.